television, DSTV, channel 392, Star Times Terrestrial, channel 127, Free TV, channel 507, People's TV, channel 285, and UHF, channel 38.
At all.
So we are always ahead, and we are always pioneer setters, and we are also pace setters to the entire event. So that is how it started, and it has kick-started all over the country, including Abuja.
Okay.
As we speak, we are sensitizing. That's why we are in your station. Okay. Yesterday I was at the radio section.
Yes.
Today, happily, I'm with you, and I always love to be here so that at least the media is carried along. We have town criers in communities, also educating and enlightening the residents on where to go to get their numbers. And when we know the number, what do we do with it?
Exactly. First, the question I wanted to ask next.
Because, so let me wait for you to ask the
because
question.
Of course it's one thing for people to know their numbers, even though we know that a lot of Nigerians are yet to develop that culture of willingly going to check some of these vital numbers. But when we know the numbers of these 230,000 FCT residents, what do we do with the numbers?
Like you said earlier, you read the theme. The theme is complete. Know your numbers, control your number. So you can't control it. Like in a car, if you are at the speed, you know, the brakes, clutch, and everything, accelerators gives you the control. So we have our primary health care, we have our secondary health care, we have our tertiary health care. So when we measure, and we're going to use health professionals that are experts in that, when it is measured and it is either high or low, and it's not normal, then there is a threshold that you will be referred to. The first line of call in every ward, there is the primary health care center. So if it is the level of the primary health care center, we refer you to the doctor immediately. And if we have any congestion that we can't refer you, we also have other apps that we now do telemedicine, where we link you up on your phone or on our phone or on our laptop to be speaking to the doctor simultaneously. So even if you are 10, 20 and we have this access, we will now create it so that at least you speak to you on your blood level, what to do, where to go, and the prescriptions, so that it can be controlled. If the primary health care center will not be able to take care of it due to a speciality or any other reason, we now refer you to any of the 14 general hospitals in the FCT across the 6 area councils. Then from there, if they can't, you know, we have the tertiary facilities also in Abuja. We have the medical centers, we have the Babagana Teaching Hospital, and the rest. So they will take care of you. And then if there are other things that we need to educate our patients, because at the end of the day, we have a projection that if we do the 230,000, we are projecting based on science that we may have about 69,000 or 60,000 plus people with high blood pressure or blood pressure challenges. Then we are adequately prepared on the drugs, on what to do. Because once we test you and you have a challenge, we counsel you and then we put you on drugs in either our primary facility, secondary or tertiary facility. For diabetes too, if you are diabetic or your sugar is high, then we will also do it. So at the end of the day also we'll give that counseling advice on our FCT health insurance, where you just pay a premium of 13,500, and for any hospital thing classified under the FCT HIS health insurance scheme, you will only pay 10% of it. That is, if you are charged 100 naira, you will just pay 10 naira. If you are charged 1,000, you just pay 100 naira. And if you are charged 10,000, you will end up. I am on the scheme. I am benefited on the scheme very well, because for whatever bill that I am given, it is affordable for me to pay the 10% of it. And that is what is global, and Nigeria is part of it, and FCT is always part of good practices that will make our people healthy.
Okay, you've been mentioning diabetes and hypertension. Are these the only 2 non-communicable diseases that you are concerned with?
Yes, for now, that is the focus of the project.
10 million.
Okay. So we don't want to be tossing a lot of balls. Since we are not playing cycles. You know, it's only people, the cycles, that juggle so many balls. So we don't want to be jack of all, master of none. We want to take one at a time. So the Commissioners Forum, Governors Forum, and including His Excellency, our Honorable Minister, Chief Ezenwenyeson Wike, CON, has approved. So we want to focus on what is on the screen. For now, on the screen is know your numbers and control your numbers with blood pressure and blood sugar level. Blood pressure level can be high, can be low. And then blood sugar level can be also high or low, but it has to be normal. Normalizing it, that is controlling it. And for now, the focus is on that for the next 7 days plus. So that we will now continue the exercise.
You know, what I enjoy talking with you is you always have a way of ending your talk with my next question, because I was going to also ask, since it's a campaign, that means it has a period that it will end. And that's what I wanted to ask. What's the duration of this campaign?
The whole exercise for planning purpose is 7 days.
Okay.
And is to achieve some objectives.
Okay.
The first objective, you know, as it is for us to have screened 10 million.
10 million.
In FCT,
that is in the whole country.
In the whole country.
Okay.
And in FCT, it's 230,000. Okay. So again, we need to provide counseling, like I told you earlier. Before you are tested for your blood sugar, blood level, you need to understand why we want to know it.
Exactly.
Because if you have high blood sugar, body pain, what have you, if you have blood pressure, headache, weakness, dizziness, and the rest. So once you know that is not a dead warrant, you know, you'll be calm and you take the test. Because if you are entering a car or an aeroplane, safety and everything is taught to you that it's not, you are not going to have an accident or what have you. These are the things that have been put. We also want to link the newly detected, and from the number we are taking, there is always a percentage that you will get that is having this challenge. So we link them up to our treatment facilities. Okay. Then we also increase public awareness, because if we get to know that it's above the normal threshold, what do? We say blood pressure issues, sugar level issues is becoming a challenge. Okay. So we'll be telling the public to have this healthy lifestyle, so that at the end of the day, prevention is better than cure, always, like they say. Always. So we will look at it. Then we will also improve the collection of prevalence of non-communicable diseases. You know, cancer is also part of it.
Yeah, it is.
But for now, you know, there is also a campaign for cancer separately going on its own. So if we know the level of blood pressure, blood sugar, then we will plan and have policies on how government can now be doing things. If it involves some other remedial measures of looking at our chocolate makers, our sweet makers, our beverage makers, if it is what is driving it, that's planning and policy. Then government will come out with policy thresholds to see that citizens are protected.
And you'll be guided by data.
And you will be guided by data that this is happening. So empirical data helps to see things go on fine. Right. Then we also, the final objective is to create a register of who is having high sugar, who is not having. And it's not because of anything, because today, if I have the database of ASO radio and television broadcasters like you, I can contact you easily to ask you some questions. Maybe like if my child wants to do mass comm or anything. So having the register also helps towards planning and having an empirical data that will guide you. So these are some of the things that the Nigerian government, under the leadership of the President, His Excellency Ahmed Bola Tinubu, the commissioners, the governors and the minister of FCT, who is also like a governor, sat down and articulated. So it is not governors forum that don't care about, they do security, they do health, they do anything that will enhance the life of every Nigerian. So this is why now the theme for this week, for the next 7 days, is know your numbers and control your number. So we will make you know your number and we will help you control the number.
Okay, this reminds me of a conversation with Malam Ibrahim Shekaro, the former governor of Kano State and former senator, who said before he was governor, he was among people who were championing for people to take their children to school, take your children to school. Then when he became governor, he now realized that the number of schools they have on ground, from primary to secondary, is nowhere near adequate. If all the people that they have been shouting on decide to say, okay, today all our children must go to school. And I'm sure you already know where I'm headed with this question. Now that you are encouraging people, particularly in the FCT, to know their number and control the number. Of course, for you to know your number, you must first of all go to a facility to conduct check and all of that. Do we have these facilities readily available, particularly in the rural areas? You did mention primary healthcare centers. Are our primary healthcare centers in the FCT equipped to be able to carry out this test should the residents of FCT heed the call?
Yes, thank you very much for this wonderful question. In FCT, we have over 261 primary healthcare centers, and active and participating and meeting all standards, we have about 62. Okay. So Abuja has 62 wards.
Okay.
You know.
Yeah, I do.
AMAC has 12, and the rest 5 area councils have 10.
Yes.
So we have 62 that is under the Basic Healthcare Provision Fund.
Yeah.
And they are also being recognized by the FCTA Health Insurance. At this level, I can confidently tell you the 62 activated per ward are ready.
Okay.
And if people will come from ward to ward, we have activated it, and we are going to also some small challenges that are here and there, because challenge is part of life. There is no ideal society. Maybe when we are lucky and we go to paradise or heaven, then we will have the ideal that we all dream of. So out of this 261, I will tell you 62 fully prepared and ready and functional to the best ability that they can take blood sugar level and also measure the blood pressure level. Then we have 14 general hospitals in FCT owned by the Federal Capital Territory Administration. So and these 14 hospitals, some facilities, some area councils have like 2. Some are even having up to 4. Some are even having only 3. So across, because we have 6 area councils and we have 14 hospitals, you know, some have numbers, some don't have. And then in addition, know that also we have some spaces we have planned for, you know, like marketplaces, you know, like churches, mosques, and then some other places that attract crowd, motor parks, etc., etc. So we have also put them. And we have also created roaming testers, people that can move to certain places and also test people immediately, clerk our data into it, and then take it forward. So we are adequately prepared in terms of security, in terms of crowd control, in terms of the health and infection control of everybody that is willing to come forward to be tested. So this is an opportunity for Nigerians, especially Abuja residents, to know their blood sugar and to know also their blood pressure. Because these days, I'm sure, Mr. Moderator, you must have had people just slumping. And just, so a lot of us are moving around, we don't even know our numbers in terms of blood pressure or blood sugar. And at the end of the day, somebody is having body pain, everything, he will not simply think of...
Have headache, you go and take paracetamol.
That's all. So this is why, you know, as for health, and you know our health is one of the best in the world. Because best in the world, we have all the manpower skills. That is why our doctors, our nurses, our health workers are soup on and taken away from us. So if we are not good, nobody will come for us. So if you are not good, you cannot japa. So we have excellent health workers, and the excellent health workers in Nigeria, especially in the FCT, that is the most diverse center of unity in the whole of Nigeria, because you can get anybody from any local government, anybody from any state, and they are ready and they have been trained to respond to whatever challenge that may come up.
You've given us every information, I should say, but you've not told us how much will this cost. Should I intend to heed the call to go know my number?
Every successful planning, the cost for the patient is free. The drugs that will be given to you is free.
I want you to say that again.
No.
Because one of the things that...
The test is free.
The test is free.
And then the control is free.
The control is also free.
So it's as free as the air. It's just to make yourself available that is costly for you. And that is your responsibility, it's not us. We can't drag you there, we want it to be voluntary. So everything under this exercise is free. And it's also, you know, to take care of Nigerians so that at least, in a way, it will change our productivity level. Because like say, a healthy nation is a wealthy nation. So also a healthy Abuja resident is wealthy Abuja. And when Abuja is rich, all of us are rich. They pay the taxes, they pay revenue. So that His Excellency, our Minister, Chief Ezemowuke, can give us more infrastructure, more roads, more flyovers, more hospitals, more schools, and everything, and also improve the quality of the manpower within it. So it's free, testing is free, controlling it, that's treating it or taking care of it is free, counseling is free. Everything that we're going to do is free. That's why we are also encouraging people, when they benefit from this free exercise, even for the other challenges, once you pick up your health insurance by paying 13,500 premium for 1 year,
Okay.
even if your health challenges for a year, for example, is 1 million, you will end up paying just 100,000.
10% of that.
10% of the total amount you will have spent. So it's a good one, and that is what is happening globally.
Just so we are guided, when is this 7-day ending?
The 7 days is ending as from the date that it commences.
Okay, so we are yet to commence.
Well, we have commenced, but we have not flagged it up officially.
Okay.
So we are flagging it up officially tomorrow.
Okay.
Yes. The flag up is going to take place around Area 11.
Okay.
And the car parks in Area 11
Okay.
is going to be at the car park of His Excellency the Honorable Minister.
Okay.
By the other side
Yeah.
of the General Pool around Legal Secretariat.
Yes.
Then we are going to have another one that is around the Finance Block.
Okay.
Where the Honorable Minister launched the vehicle for the
Yes.
security agencies. We're going to set out that, and it's going to be going to go on even at our staff clinic at that secretariat. Then it's going to go on at the car parks. So it's going to run from tomorrow,
for the 7
Thursday
days.
and Friday, completely for the 7 days.
So no weekend?
And we will, well, health workers don't have weekend. Maybe even journalists, I'm sure. We're essential workers.
Definitely.
So we have never enjoyed weekend.
There's
as
no
long
weekend.
as you are in service, that's why they say there's a call duty, there's emergency.
Of course.
And
You can be
everything.
called even while you're on
maybe
leave.
for you people you enjoy, but
You
for us,
don't.
we are like the soldiers, but we are soldiers of health.
And soldiers of health, of course, are soldiers of life.
That is it.
Because life is meaningless without good health.
That is it. That is
Just to recap what we've been talking about with Dr. Babagana Adam, the Permanent Secretary, Health and Environment Secretariat of the FCTA. Of course, there is a project ongoing to be kicked off tomorrow officially that will provide opportunity for 230,000 FCT residents to go get tested to know their numbers for hypertension and diabetes. And when you are, of course, when you know your number and there is a challenge, he has already mentioned there are different stages depending on what you present. After the testing, definitely there are facilities to attend to you, to take care of you. But the icing on the cake for me is that all of this is entirely free. The only obligation that you owe yourself, and I want to say your family, is to present yourself. He mentioned people slumping, which is very, very common phenomenon, not just in Abuja, but all over the country. You just hear that someone slumps and dies. And this is becoming something that needs attention. I want to believe, sir, that was what informed this decision by
and you know, if
Health Commissioners Forum.
You see a lot of our workers recently, just slumping and dying, or just not waking out from sleep. But just so you get it right, it's just like saying you have a kind of beverage. Either it is Pepsi or Coke. If it's popular, you will say, give me Coke. But when they give you Coke, you say you want Pepsi. There is this nomenclature that is erroneous. When you say high blood pressure, we are not only measuring high blood pressure, there's also low blood pressure.
Low blood pressure, okay.
So what we are looking for is blood pressure.
Blood pressure generally.
So we want everybody to be normal.
Okay.
But when it is high, it's also an issue. When it is low,
it's also an
like
issue.
they say too much of everything is bad.
It's bad.
And small also is bad. So
Moderation.
You should have moderate. So we are looking for blood pressure numbers. High or low, we control it. Blood sugar level, high or low, we control it. So at the end of the day, this is what the government is focused on doing, so that at least our citizens can be fit and healthy. And a happy nation is a wealthy nation.
Definitely.
A healthy nation is also.
Definitely. And just so you know, in case you're watching us and in case you've listened to the radio campaigns and other platforms that are being used to create awareness about this very, very important campaign at this point in time, all health care facilities that belong to government, whether they are primary health care, whether they are tertiary health care providers, or secondary health care providers, as the case may be, you can, of course, access these services from any of them, particularly the primary health care centers, the secondary health care providers, and even the tertiary health care providers. You can just walk in and get tested. And in addition to this, he has mentioned there would be mobile testers going around, so that in case you run into them, I don't think it takes you too much time to get all of this
we
done.
we run a test, and I think it's just going to take us less than 4 minutes.
You see, so I don't think 4 minutes is too much for me to give in a day,
yes.
for me to know who I am.
We just have a form, and we fill it out. It's just a 1 page.
Oh, great.
Or certain informations have to be taken.
Definitely.
Your number,
Definitely.
some basic information.
Definitely.
So, and then the test results will be entered, and your data is protected because we are government.
Of course.
And we are not taking anybody's information or data to sell it or to do whatever. It is for health
purposes,
for health planning. And at the end of the day, when you plan health, you come up with policies.
Definitely.
And these policies will be what is good for us. And knowing that Nigerians are concerned about our health, I'm sure people will benefit and they will see the result of it.
I also see another advantage to this, particularly to the government. With this exercise, definitely data, numbers will come up, and this will help guide government
of
further.
Course, that's part of the
exactly.
objective I reeled out to you. Because to know the numbers, you'll be able to plan.
Definitely.
And when you plan, you bring out policies that will address that plan. So again, you said it's free. It is free. But know that nothing is free. Somebody is paying for it.
Somebody is paying
for it. And that is
it.
your government from FCT paying for it.
True. I think that point is very, very important. Someone is paying for it, and that's the FCT administration that has already taken care of what it will have cost you ordinarily to go get your blood pressure number and diabetes tested. So this is a very wonderful opportunity, and the only thing we can do from this end is to encourage you, wherever it is you are, as a resident of the FCT. Is there age limit to this, children?
Yeah, I don't think there is any specific, because it's up to 59 years or so. Certain. So
all right.
So anybody that comes, so, I'm sure. But you know, most of it is expected is adults.
Adults, definitely. But if you can, why not? If not, take along your family members to go. And the beauty of all of this kind of campaign is don't go alone. Go with someone else, and so that the numbers can increase, because you are helping someone to know their number. He gave example of you driving a car. You know, when you're looking at the speedometer and you are aware of how fast you are going, you exactly know what to do, when to apply the brakes, when to accelerate further, and what not. But what more of your own life, something as important as your own life, which is the only thing you have. And I don't think anybody has ever reported having two slots to this beautiful thing. You can't play kalu with it. We must be deliberate, we must be intentional, and this is why we, as ASO Radio and Television Services, will continue to commend the FCTA administration, and particularly the Health and Environment Secretariat. We have to say, we've been saying it on record, sir. There is any secretariat in the FCT system that is up and doing when it comes to public awareness like the Health and Environment Secretariat.
Thank you.
From our own perspective.
Thank you very much.
We don't shy away from saying this. Other anchors of other programs have been saying it, and I have also been saying it. If we've had visitors, the highest number has always come from FCT, Health and Environment Secretariat, talking about malaria control, the malaria control program, just about tuberculosis, about 2 weeks, HIV/AIDS. About 2 or so weeks ago, we were with the glaucoma team, who were also on a campaign to call on people to come get their eyes tested. And the treatment for that also was for free. I don't know if the campaign is still ongoing, but the point being made is that you're doing a very wonderful job.
Thank you very much.
Especially with respect to engaging the public, which is very, very crucial to the realization of any project at all that you've embarked upon. Except if you have any other final words, I think this is where we'll have to call it a day. But definitely you must give us your final words.
Okay. Thank you very much for the commendation for the Health Services and Environment Secretariat. You know, we are under the leadership of a very proactive and visionary leader, His Excellency Ezemo Wike, CON. And you know, we have also a mandate secretary, Dr. Adedolapo, who, apart from being a doctor, is also an environmentalist. So also, you know, I'm a friend of the media.
Definitely.
So you can't clap with one hand. If you must do it well, you should involve the media.
Definitely.
Because knowledge is power.
True.
If you don't know, you don't know. But if you know, it gives you that ease of solving your problem. So I am appealing to all us to be health conscious, pay our dues, pay our taxes and revenue, so that FCT can keep on doing the good things our minister is doing. And then please, whenever you have any health challenge, our hospitals in Abuja in terms of health professionals is one of the best in the world.
Very true.
Go there, be consulted by experts, then we take care of you, and we are striving to do good things for the residents. They pay your taxes.
Pay your taxes. Thank you very much, Dr. Babagana Adam, the pioneer. I like to add that pioneer because no one has done it before. So pioneer, Permanent Secretary, Health Services and Environment Secretariat of the FCTA administration, for this very opportunity, despite your very tight schedule. I'm sure you've been looking at your phone. You want to go join the Honorable Minister in the series of flag off of projects that has been going on since last week. Thank you very much for giving us this time. We don't take it for granted. And thank you also for investing your time with us this morning on ASO Morning. My name is Usman Khatun Umar, urging you to continue to be deliberate about your health. And I join Dr. Babagana to say, pay your taxes. It pays to pay your tax, actually. Have a very wonderful day ahead.
Thank you very much.